Not often that a surgical technique becomes a national craze, but endoscopic or minimally invasive surgery has. It's in the newspaper, it's on the lips of patients who can't resist showing off their tiny scars, even on your commute to work. Billboards trumpet the minimally invasive surgery offered by hospitals. Joining us now is Dr. Fred Harrington, Director of Spinal Surgery and Medical Director of the Young Endoscopic Spine Center at the UNM Sandoval Regional Medical Center and the University of New Mexico Department of Neurosurgery to talk about these. So, first of all, Doctor, you wear a lot of hats. You're a busy man, very busy man.
I would say so.
Yeah, so let's talk about, just very quickly, UNM Sandoval Regional Medical Center. What's going on over there?
Gee, it's a beautiful new facility, Chad, that was opened up by UNM, and it's just a terrific place. It's in Rio Rancho, up near the Star Center,
Okay.
and state-of-the-art place.
Okay. So we're talking state-of-the-art, we're talking endoscopic spine surgery. What exactly does that mean?
Endoscopic spine surgery means surgery through, without a real incision.
Really?
So, yeah, what we're doing here is we're using a tube, an access tube about this big, that goes in, and then it goes into the spine to do the surgery. It has a camera at the very tip of it, so we're looking at a screen, and we're looking at the pathology, and this tube not only has a camera, but it also has places that we can work and do the surgery.
That's incredible.
Yeah, and the difference is that we don't have to remove much bone, or any bone in most cases. We don't create much pain, if any pain at all, to do the surgery. So it's really, really new and really different.
Okay. Now, in terms of we'll talk about the discomfort and recovery after this, but just to get my head around this, the Laser Spine Institute, is this similar, or are we talking totally different technologies?
Different.
Different.
We use lasers, they use lasers. The way we get into the spine, as far as I understand it, is in a more minimally invasive way than they do. They use more traditional incisions, as I understand it. Could be wrong, but this is, what we're doing was brought to us by Dr. Anthony Young, a true pioneer in the field of endoscopic spine surgery. And he's a UNM graduate, and has, for that reason, a relationship with us, and we have taken on this technique that he pioneered.
That's amazing. So in terms of recovery, when we think of back surgery, spine surgery, my thought is always recovery time. And it's, you know, I always think of, because I've had family members that have gone through spinal surgery. What are we looking at in terms of recovery? I'd imagine that if it's minimally invasive, that also cuts down on our recovery time.
Well, that's right. We don't even put the patients to sleep. They don't have general anesthesia. So there's none of that recovery. And what you notice when the patients wake up is they notice the good things that have happened, yet they don't really struggle with very many bad things.
No kidding.
And within half an hour to an hour, they get up and walk away and go home.
You're kidding? That quickly?
Yes, sir.
That is amazing. Wow, that's fantastic. All right, well, folks, for more information on this, if you are considering spinal surgery, you want some consultation, head over to casa.com, click on the Style tab. We will have links to the Sandoval Regional Medical Center. Doctor, thank you so much for this information.
Jay.
Absolutely.